2016 has been a great year for university research projects that not only engage with the public through the fieldwork that helps deliver them, but also makes a tangible difference to the lives of real people up and down the country. In the second of the biannual Engage Awards, organised and run by the National Coordinating Centre for Public Engagement, 18 varied, inspiring and significant projects spanning 6 categories were nominated at the NCCPE's 2-day Public Engagement Conference in Bristol. The Engage Conference looked at how higher education can continue to work with external partners to deliver successful research, and the nominees discovered at the award ceremony held on the first evening whether their project had won. In the hotly contested individual-led category, where one person's leadership of a project was celebrated, the award went to a project called Eating for Eye Health, run by Rose Gilbert from University College London. Working in partnership with Moorfields Eye Hospital, the project looked at how good nutrition in later life can help to prevent degenerative eye disease. The judges said the project was an example of a clinical researcher seeing a problem and taking it on rather than just writing it up. It's a great example, they said, of what one person's enthusiasm and drive can do with a small budget. Well, after the ceremony, I caught up with Rosie and asked her to tell me more about the project. Eating for Eye Health. How does nutrition help eye health?
There's limited evidence from clinical trials that antioxidants, and in particular colourful antioxidants found in pigmented foods such as beta-carotene and vitamin A, that can help protect the retina from environmental stresses, particularly ultraviolet light, and stop it from developing degenerative changes over time that will affect people's central vision, which is critically important for doing close tasks such as reading and also recognising people's faces.
Okay, so and your research is concerned primarily with age-related macular degeneration, isn't it?
That's right, and in particular the dry form, because there are 2 forms, and that's something that people may not be familiar with. There's a dry form, which is just a degenerative change, but there's also a wet form where you get fluid in the retina, and actually there is some treatment for the wet form in the form of drug injections in the eye. Not a particularly pleasant treatment, but it is a form of treatment which is not available for the dry form.
Okay, so there are all sorts of ways you could have approached this, Rosie. You could have gone, well, I'm just going to write a thesis or a paper, but you took a different, more creative, more immersive approach, didn't you? So explain exactly what motivated you to do the project in the first place, and then how you delivered it.
My motivation for doing the project was through my day job as an ophthalmologist, an ophthalmology registrar working in the clinics. So I work in a lot of general ophthalmology clinics where we see a wide cross-section of the population with different eye diseases. One thing that I found particularly disappointing is that I would see older people who would come to the clinic telling me that they couldn't see. I would take a look in their eyes, see that they had dry macular degeneration. And of course, the next question was, so what can you do about it? Is there an operation or some treatment? And I would say, I'm really sorry, there's no treatment, and I'll have to discharge you from the clinic. And that was a very, very difficult message to deliver to people. I was able to tell them that there was some limited research from clinical trials that they could take antioxidant supplements, but there was very little further information that I could give them. And of course, not everyone can afford to buy supplements every month. So that's where it came from. I thought, well, this is really not a good situation at all, and it's leaving patients feeling like they cannot support their own health in any way.
Okay, so nutrition. Is there a proven link? I mean, you're an ophthalmologist, you know better than me. What is the link between nutrition and eye health then?
And that's unfortunately where we're very shaky. So I graduated from medical school in 2007, and the nutritional training and that I had was very limited. And in fact, I don't think that nutrition is a big part of the medical school curriculum now. But we're having increasing amounts of evidence, certainly from basic science, that antioxidants can prevent against general inflammation in the body, and we do know there is evidence to suggest that there is an inflammatory component of this disease. So the idea is in some way having these sort of antioxidant, vitamin-rich foods can protect your eyes from damage. But following from that, it's pretty limited. The evidence from trials is very messy because there are so many other environmental factors involved. So and no one really wants to look at it because it's not an easy area to work with, which is why it's been pushed to a side. So I thought, well, someone needs to tackle this, and someone needs to talk to the people with the disease and their friends and their carers to find out, well, what is important to you? How can we help you?
And you knew just the person, didn't you? You.
Yeah. Yes. Yeah.
So I'm intrigued by your project because it must be quite hard to engage people in what is quite a, I'm not entirely sure what the right word is, but it's quite an transient sort of notion, isn't it? How as somebody without any medical training, without any knowledge of the subject, how do I care enough, because I might not necessarily see the effects, excuse the pun, but I might not necessarily be aware of the effects on my eyesight of my diet. So how did you go about engaging people?
So the really interesting thing about this is that, of course, food is not like medicine. With food, there comes a whole other social and community aspect, and that was something I felt that would be really important, particularly in this population of older people and people that may have found themselves becoming more isolated because of their eye condition, the disease itself, and their sort of diminishing ability to see. So that's why the community engagement approach was, to me, particularly important. So it wasn't just about, I'm going to give you a list of foods that you can eat or go away with. And I think also, these are older people. They've been around in the world a lot longer than I have. They probably know what is healthy versus what is not healthy. So really, it was a case of talking to people and finding out, well, if I gave you a list of foods or a list of recipes, would you be interested in cooking them? What has made you say not eat these foods before? It was about finding out the barriers to doing things. The same as the rest of us. We all know we should eat healthy and exercise, but various reasons mean we're not doing it. So particularly for this older population, I thought it was important because if you look around at what's on television, on the radio, it's all marketed really towards a younger group, and particularly with the aging population, I thought this is a really interesting area to get into and find out what is motivating these people, what are they eating, how are they eating, that kind of thing. So there was a whole other interesting side to that as well. So I basically did a focus group, and I said, well, what kind of foods do you eat? We had a discussion, said, has a doctor ever spoken to you about nutrition before? A lot of people said no one mentioned this, and I found out after I had the diagnosis that was it. There was nothing. And then I said, well, what if we offered you this? What if we offered you a community cookery day? Or would you be interested in coming up with recipes? And people were really enthusiastic, actually, about the idea of cooking and recipes. They wanted to contribute their own recipes. And so in that way, it was sort of a grassroots thing in a way that was coming from the patients. It wasn't as though, I'm certainly not a nutrition expert. I was working with one, but I was learning as much from them, and they were providing some of the recipes and ideas themselves. So that was the way to bring people along with the vision.
And the patients, the subjects of your research came up with their own recipes, didn't they? They cooked their own stuff. They cooked each other's recipes, I assume. Yes. So when's the cookbook out?
So that's something we're working on at the moment. So we had a few. We asked people to come forward with their recipes, but actually people were quite shy. That we had a few recipes. So in the end, what I did was I consulted with a local community centre that has been running community kitchens for the elderly, and we adapted some of the recipes to make them more antioxidant rich. And those were the ones we used for the community day. But then since they've been published, so on the website, more people have come forward with different ideas. And the community centre themselves have already come out with this wonderful booklet, which was sponsored by a housing association, which has a picture of the individual with the recipe that they put forward. And I think something like that would be really nice. And probably because with food comes stories, comes memories. And I think that would be a really nice thing to build into it,
Okay. And you, by your own admission, you know a lot about eyes, but not so much about nutrition. There must have been one or two moments in the project, and Where's the project at? Is it finished now, or?
No, so we ran a focus group and a community kitchen project, and then really I'm wanting to take it forward into research which is going to be led by patients, and also introducing a bit more diversity and scaling it up. So that's the stage I'm at: information gathering, trying to build partnerships, trying to look at the landscape and see what we can do.
So the question I was going to ask before I got sidetracked into finding out where the project had got to
Yeah.
was, there must have been a point, because you've been on this learning journey yourself by your own admission. What was the point, or was there a point where there was something you learned where you went, oh wow, okay, well I didn't know that?
There were actually quite a few of those moments, and it was actually early on when I was so excited by the idea of the cookery project and bringing on the patients. And then I went to, there's this wonderful thing at UCL called the Community of Engagers, where people interested in public engagement come together and they talk about it. And then during that, I suddenly realized, I'm getting people with partially sighted people and putting them in a kitchen, an unfamiliar environment with hobs and hot water and knives, and I don't know what to do. I see people in clinic with partial sight, but I don't know what it is like to live with visual impairment, how people function day to day. So that was a bit of a penny drop moment, realizing my own ignorance in dealing with the people that supposedly I'm an expert in looking after.
Well, I think it's an amazing project. I wish you really a lot of luck and goodwill with it, and good luck in the awards tonight.
Thank you so much.